The DPH annual report provides an overview of the health of the population of Lanarkshire, and it identifies the things that we need to do, and it also looks at the things that we have been doing to protect and improve the health of the population within Lanarkshire. Ebola virus disease is one of a number of viral hemorrhagic fevers present in Africa and in parts of Asia. Its incubation period's 2 to 21 days, and its symptoms initially are very non-specific. They includes muscle pains, fever, headaches, very similar to other diseases such as malaria. However, when that progresses, there's a risk of the bleeding mechanism in the body being deranged, and it can lead to death. The current outbreak originated in West Africa, in Guinea, Sierra Leone and Liberia, and we know that up until March 31st, 2015, there had been 24,000 people affected and there had been 10,000 deaths. The main way it affects us in Lanarkshire, and indeed in the UK, is by travellers returning from those countries in West Africa, and that includes volunteers such as healthcare workers who went there to help those countries. We participated in the NHS Lanarkshire Ebola Preparedness Group, and that looked at developing local protocols and guidance based on the national guidance that we had. We developed training and education for our staff who are going to be dealing with these patients. We had cases, possible cases, which came to the infectious diseases unit at Monklands Hospital, and although all of those patients subsequently turned out to be negative for Ebola, the way that we treated and cared for those patients helped us develop our care for Ebola. In addition, we were able to undertake exercises both in the infectious diseases unit and in the emergency departments within the 3 acute Lanarkshire hospitals to help us prepare for these patients. Between January and April 2015, we had 182 confirmed and clinical cases of mumps within Lanarkshire. Normally we'd expect about 17 or so cases, so we had a 10-fold increase. This was also seen in other parts of Scotland, and we know this happens every 3 to 4 years. The reason why this occurred was that although the MMR vaccine uptake levels are high, the effectiveness of the mumps part of the vaccine is 90%. Now, no vaccine is 100% effective. So over time, you have a build-up, a pool of people who have less immunity to mumps or no immunity to mumps. And every so often, these outbreaks happen amongst that population. It's estimated that in Scotland, we will lose £1.5 billion of benefits. And in Lanarkshire, that's no different. So families on benefits will lose that resource. And we know that people who have disabilities or who have health problems will be disproportionately affected. These services have been set up in health settings to mitigate the effects that the welfare reforms will have. And what we seek to achieve is ensure that people get the benefits that they're entitled to. And over the last year, over £500,000 extra has been provided for families in Lanarkshire. Food poverty, to paraphrase the definition, is being unable to get, or the feeling that you will not be able to get adequate quality or quantity of food. And obviously that affects the health of individuals and families. Well, we realise that providing emergency food, crisis food, is not enough, and we're working with partners because ultimately this is about poverty and people not having enough money to buy food. So we're trying to tackle that. We talked about benefits previously and ensuring that people get all the benefits that they are entitled to. We're providing campaigns to ensure that people have access to nutritional food. And yes, food banks are part of that, but it's part of a broader range of activities for Lanarkshire people. The last year has been good. We know that the health of the population of people within Lanarkshire is improving, but it's not uniform. I've highlighted some of the issues about health inequalities that exist. We need to narrow those health inequalities. There are other things that develop, such as Ebola virus disease, which we need to tackle. These things will happen all the time, so that we need to be ready to meet new challenges, but also to improve the health of the population more generally, but narrow those health inequalities as well.